Hopefully the folks online can send their questions in through the Slido format, I gather, and we've got runners here who will bring your questions to me. There is audience participation in this, so this is your chance to ask some senior, successful, approachable clinician scientists how they have managed to get to where they are, how they've managed to survive in the world of being a busy clinician and a busy researcher and deal with ethics, governance, families, colleagues, patients, and every other thing. So I'll let you gather your thoughts. I know that there will be additional questions coming through, but if the panel can bear with me standing up to one side and while you're being hooked up, I haven't pre-prepared them with questions, so they're just going to be hammered with questions cold call. So what you're going to be getting is honest responses, flight of ideas. But I think one of the enduring themes that's come out of today's talks, and for all of them, I think, is this notion of persistence and perseverance. And I think it seems to be the hallmark of successful clinician scientists is this concept of perseverance. Bala, I guess you were the first to sort of put that as a set of dot points on your slide. So maybe can I ask you to just scope out for the audience here just what you mean by persistence? How hard do you have to work? Is it all hard work? Is there fun along the way? Just share with us your secrets about your persistence.
Look, I mean, research is hard work, and there's no question about it. And there is if you're a clinician scientist, there are some jobs which allow you some non-clinical time and guaranteed research time, which allows you to focus. But the persistence is, I think the persistent factor is different in that it's not just about time. It is just about coping with challenges. And you can't give up easily because very often it is let me give you some examples. So 4 years into the adrenal trial, a research officer in North Queensland, in the context of evaluating annual reports and ongoing approvals, suddenly came up with a question and then circulated an email which essentially led to the trial suspension after 4 years of enrollment. And then we had another instance where we were exporting the drug overseas to other sites, and the TGA had a new employee come in, and he was looking at an annual extension of approvals, and the TGA suddenly decided, hold on, the original approval was wrong, so you can't export drug overseas, so you've got to stop. So challenges like these keep coming, and you've got to persist. And there is no simple formula for it. You just, like a dog with a bone, you just got to fight it.
Could the other panelists maybe expand on that? Does anyone have any other questions about this or comments about the persistence? Dietmar, you were talking about a 20-year horizon for getting some cool ideas into the clinic, and they've still got a place to go. That's persistence, I would say.
Yeah, but for me, that is important, persistence. But also, this term we always use, you have to put in the hard work. I think this is overemphasized, and it is just said so colloquially and turns a lot of people off, right? So what is much more important for me is actually that you have a passion, right? So I guess you have heard this from other, this is said before, for example, by some successful entrepreneurs. When you really have that passion, like I have for myself, I wake up in the morning and I'm passionate to go to the lab. I'm passionate to work with my students. I'm passionate to work with Michael and so on. And of course, there are problems I have to solve and so on. But that really gets me out of bed. And then when I have that passion, I don't think about hard work because I'm doing my passion. So for me, it's really important to get to this persistence, to sustain, that you find that passion. If you don't have that passion, then I think it will be very, very hard to be persistent.
Thank you for that. So I've got a question from one of our online listeners who is expressing passion. They're a first-year biomedical science student, and they have an ambition and a passion to get into medicine. Where can he or she find opportunities to partake in research and gain great experiences leading up to a career in medicine in the future? So maybe Claire or Michael, you might want to share some ideas about how people might break into research early in their career.
Ladies first.
Thank you. Look, I think there are some huge opportunities these days. I mean, I think, you know, if you're entering, or if you're a biomedical scientist now, and you are interested in clinical research, there are lots and lots of wonderful places you can work with other scientists who have got contacts with the clinical space. There are institutions where you can have interaction across that whole clinical space. And these days, nothing is done really on your own. Very little can be done on your own. And I think the other thing that has come out of all of the presentations today is that the whole of clinical research is a collaborative space. And so, you know, it's finding, taking advantage of all of those opportunities. So reach out, contact people. You know, I started with very little, but I was very lucky, and I worked with people who were interested in answering questions. And I found that other people were actually very helpful. And if you engage other people right across, you know, from basic science right the way through to the administrators in your hospital. So we have a fabulous working relationship with our ethics groups, with our, you know, with all the people, all the players that are required to help you to deliver clinical research. And I think if you're interested in that space, it's looking around, finding opportunities, and also finding where your passion lies. Because, you know, there's no point in going into, you know, cystic fibrosis if it really doesn't grab you. It might be that you're grabbed by something else, and you need to find what really you find interesting. And that's something that is part of being a student. So you need to find where your interests are and then find those opportunities. And there are huge opportunities out there these days. And I think contact people, go to meetings, ask questions. You know, if you don't actually ask things, then you don't get anywhere. So I managed to get a collaboration going that's lasted for, you know, some 20 odd years with different people, just by asking questions and by chatting to them. So chatting in a lift, going to a meeting and, you know, saying, can I have something? Can you work with me? And people can only say no. So you don't lose anything. You lose a bit of pride, but, you know, that's the other thing, is that actually research, you have to really have a hide like a rhinoceros, because you're going to have papers turned down, grants turned down all the time. And so you just have to keep trying, and you have to quite enjoy that journey as well, because if you don't, and you learn from each time as well. So for me, it's a learning process, and that's fun. That's what drives you to doing the next bit. So I'm not sure if that really answered it, but.
No, that's very helpful, because you've mentioned both passion and being out there and talking to people. Really, there's a lot of folks out there who are very happy to help students. So don't be afraid. All of us will get emails from people all the time, and we'll happily respond to those emails. And if we're not quite the right fit, we can put you in touch with someone else. So never be afraid. Go to the websites where we work, find people, get our emails, get other people's emails, and pursue it. Michael, I haven't let you have a chance yet to respond to this question about research, and particularly as a coalface surgeon at the cutting edge, as it were, how would you encourage students to get into research?
I, until recently, was the supervisor of training in plastic and reconstructive surgery across the way, and also mentored quite a few medical students. So My answer to this question is as a little bit of experience in the clinical space behind it. And it is actually my favorite answer to any question, which is it depends. It depends on what you've done. It depends on what you're really interested in, and it depends on where you're going. And the answer to some of those questions may well be, well, I don't really know. And that's cool. That's totally fine. But, you know, suffice it to say, as we've heard, it's really hard to research something that you're not particularly interested in and not motivated about. That's when it gets particularly hard. And I suspect we've all been there at some stage, you know, just trying to finish this thing off that we were, you know, given to do. And so if you're looking to just pursue research as a means to an end, it is quite hard work and low yield. And you certainly see enough of those people, particularly who want to either get into medicine and are trying to buff their CV up, because the way medicine school works these days is a little bit different. But I see it a lot at the stage where people are trying to get onto specialty programs. There are people who recognize their CV is a bit weak. They say, oh, look, the best way to buff my CV is to do some research. So they come and see me and they say, can I do some research? And you're like, well, what do you want to do? And they haven't even thought about it. So I encourage people to go away, find something they're interested in, and then come back to me with an idea, rather than me just giving them a list of my ideas, which doesn't ever work very, very well. So yeah, it depends. Come and talk to me if you want.
There we go. So one pleasant aspect of a research career I have found is the opportunity to travel. And in part, that's because really not all the excellence is in Brisbane, and people often go away to get extra training. I can see on this panel that people have come from all over the world, have trained in different places. And that leads to issues around collaboration and networks. Can you, as a panel, describe for us the importance of networks and the importance of getting out of your own bubble and into other spaces? Who'd like to take that ill-defined question?
Yeah, look, networks are important, but sometimes, I don't know, it can be a little bit overemphasized. Like if you're looking far afield to network with someone, you may actually miss the fact that one of the world leaders in what you're interested in is actually in the same city. That happens. And Dietmar and I had been working in parallel for ages before we realized that we were working in the same town. So, you know, if you want to network, do it locally first, and then you can build up a little bit of momentum. You know what I mean? Yeah, I loved traveling when I was younger and didn't have kids, but I hate it now. It drives me bananas, and it seems like a colossal waste of time. So, sorry, different perspective.
So that's one perspective. There may be others on our panel. Bala, would you like to say something?
I have a slightly different view.
That's why
I think, for example, again, just going back to my own trial, it would not have been possible to do a trial of that nature without having networks. I mean, our clinical trials group, the ANZIC's CTG, the clinical trials group, we are the most prolific clinical care trials group in the world. We have published far more New England Journal and JAMA articles than any other clinical trials group. And this is because their network is solid. They provide the research infrastructure, they provide the ideas. You couldn't sort of go to the CTG and say, I want to do this trial. You will have to get it past a scientific subcommittee, you've got to present it formally. So lots of feedback happens, the research infrastructure is there, with a lot of support. So I think the network is important. And that leads to both, not only nationally, but international networks as well. I mean, if you're going to do a trial, which is not going to work just in an Australian healthcare setting, but it's got to have international generalizability, then you have to have multiple, it's got to work in different healthcare systems. Then you have to have people in different parts of the world with whom you network to be able to do that. And just to go back to the previous point about the research question, we have a question in mind. One of the things that I find when registrars and medical students come to us, they actually do not know what they're interested in. That's the challenge they have. They're just not sure. They say, look, I want to do research, and but I do not know what you're interested in. I tell them, okay, then you just got to take part in something to understand the process of research. And then you may or may not like it, and that's a different story altogether. So my view is when people come to me and say, this is the project going on there, you can join in, but you've got to take part in the data collection and so on and so forth for you to understand what actually it means. Sorry, just to go back to the previous question.
No, that's absolutely fine. I saw Dietmar raise his hand there.
Yeah. So I think to bring it back to the students and the young clinicians and scientists, I think there is a quite different motivation about the traveling and the networking, right? So, you know, from this perspective, I think on a more adventurous basis, right? You want to go out because you also want to develop your character, right? And what I have seen by myself and many of my students. So, for example, I was the first one in my family actually who traveled out of Germany. So I started actually my research project in Coventry, but at the same time I applied to do my master's thesis project at the University of Utah with Wilhelm Kolb, the inventor of the artificial kidney. So, you know, when I was in Coventry, 4 weeks, I got the letter to go to the US. When I talked my student fellows and my parents, they thought, this is the most craziest thing in the world. I had school English, right, for 8-9 years, but I wasn't even close to speaking it properly, right? So I was struggling already in England, not about just the English writing. So I went to the US. I lost my luggage at the airport. I was without my luggage for 4 weeks and so on. And I can tell you, I cried a couple of times in the first weeks in Utah. And that was an experience which built me. And when I look back, that I trained under Wilhelm Kolb, it's just amazing. But when you would have asked me the first 4 weeks in Utah, I would have told you, put me on a plane, bring me back to my hometown, right? So again, if you do this, I think it's very important for your character. And again, I have seen this over and over again because, for example, I get a lot of students from Germany because I still have visiting professorships at German universities. And, you know, even so, you know, Brisbane is so awesome and they come here for the weather, for the surfing and so on. The first 3 months is not that pretty. You know, they go through this period. But when you see how they develop then after this time, it's quite amazing. So that's one thing. But the other thing is, I think, you know, when you're at that stage, you want to go to somebody which you look up to and where you want to be mentored. And not just by the person, but by a department, by a research group, right? Because that's what you want to take away. Because again, that is really a fundament of your future career. If you go away and you do a short-term or a long-term fellowship, and that's done on the wrong footing, that harms you for the rest of your life. So that's also very important.
That actually is a nice segue into one of the other questions that is down here about the importance of mentoring. And have each of you had a mentor or mentors throughout your career? And if so, what were the qualities that made that experience successful for you? Claire, you've been silent for the last round, so I'm going to throw that question to you in the first place. You mentioned a couple of mentors in your talk, so maybe you could just expand on that.
Yeah, I think for me, it's not been one sort of main mentor, but lots of different people have really helped me to develop various different parts of my working career. And so looking right the way back, I think I was very, very impressed by the clinical trial teaching of the group in Melbourne when I was there. And I went through the courses that they were offering. And it was really through that relationship that I was able to develop some of the skills that I needed to really, I suppose, write a protocol for a clinical trial and start to look at how to do that. And the initial clinicians who also helped me with that were the people in my department. So it was a group, again, who helped. There were senior clinicians, there were senior statisticians who really, I suppose, helped answer questions that I needed to develop a clinical trial protocol, to get it through all those regulatory issues that have been talked about. There were fewer of them then, but there was still quite a lot of challenges, and to get things set up. So that was a sort of very important part of it, but there were also others. So, and I've had experience of really bad episodes too. So, I'm going to share with you a story of my family. So my daughter is a scientist, and she went to the UK following the need to go overseas, and her parents have both traveled, and she thought this was a good idea. She went as a postdoc to one of the big institutes, the Crick in London. This was meant to be a fabulous opportunity. Well, she went into a small lab, which when you look at it, wasn't really well set up for her. And she had a boss that was hard work, and there were lots of issues with bullying. There were lots of problems with that whole process. So this is not straightforward, and she's come out of that fairly scarred, I might add. Now she's very lucky, and she's fallen on her feet coming back, and she's got all sorts of good things happening. So it's not a complete disaster story, but it's not always easy, and it's not straightforward. And I was talking to somebody over coffee about how difficult it can be sometimes, because you're not always matched with, you go somewhere, you're not always matched with people who actually are able to, push you along. So you need to be careful about how that works, and you need to think about what's going to suit you best. And you need to say no and leave if that's not suiting you best. And I think that's important. It's making decisions, making choices for yourself as you go through, and learning from it, because you can always learn. Every experience will provide you with an opportunity. So I don't think it's straightforward. The whole mentorship issue is not also straightforward. It's difficult to know how to be a mentor, actually. I'm the world's worst teacher. So, I find that quite challenging. But I've had successful PhD students, not many, because I hate doing it, actually. And that's tricky. I always find myself unable to give enough time, and I find that difficult. I prefer to be able to, if I'm doing it, have enough time. So I only ever have one or maybe two at the absolute maximum. But this is not easy, and not everybody is well set to be a good mentor or to provide that support. So you need to find the right people.
Anyone else on the panel want to add any comments about mentoring at all?
Yeah, I am not the poster boy for mentorship, just quietly. I have very fixed ideas about the mentor-mentee relationship. The College of Surgeons made the mistake of asking me to talk at the DCAS, which is the Developing a Career as an Academic Surgeon course. It's like the day before the big College of Surgeons conference. So I flew over to Perth for the day, so I was in a bad mood already, and completely hosed down, the whole mentor-mentee relationship by saying that the best mentor-mentee relationships are self-assembling. And when you try and force two people together in that kind of relationship that kind of don't belong together, it's just an epic fail. I've seen it happen so many times. So the people that I end up mentoring and menteeing, it just kind of happens. Do you know what I mean? I don't seek them out, and they generally don't seek me out, because if they do, it doesn't go well. So, that's how I feel about mentor-menteeship. I know that's uncool, and the university...
No, can I push a bit further?
Yeah, sure.
Have you in your own career benefited from a mentor who has helped you? And so how did you make that work?
100%. It wasn't like official, right? It wasn't like I sat down and said, will you be my mentor? Or they said, can you be my mentee? It just, I just take bits of what people have to give me, and I put it all together, and I become my own person. But of course, I have a research bunch of mentors, and I have a clinical bunch of mentors. And in fact, I have hand surgery mentors, and I have peripheral nerve mentors, and I have, other bony work mentors and head and neck mentors. And, and that's kind of how it works. It's not one person that you should look at to become the best version of yourself. It should kind of be whoever gives you the stuff that makes you go, yeah, I really want to be like that person for this little bit of, who I am. That's how I feel about it anyway.
Yeah, I agree.
Yeah. I fully agree with Michael, but there's another form, right? So again, for me, when I went to the US, and I think Willem Kolb was one of my mentors, but he never said, I'm your mentor, right? He said, you're my student, right? So
Which is a different relationship.
exactly, right. But now when I look back, this 1 year was so fundamental in the development you talk about, Michael, right? That for me, even so officially, he was never a mentor. He has been so important in my career because what I have seen him doing, being his student, how he would put these interdisciplinary teams together, right? And I think that's another way to look at it, right? That, as Michael described, it's not an official mentor. You go somewhere and then you just look how, this colleague is running the lab or how this postdoc is doing these things and so on. And then you look back and say, I have taken this away and now I'm using it.
Yeah, you often realize it after the fact.
Yeah.
That person was a mentor because now
Okay, so I am conscious of time. I know people's tummies will be growling soon, but there's a couple of questions here that have come through on the same theme of managing your time. All of you people on our panel are busy people. What tips can you share with our audience here and online about how you manage your day, how you manage your week, how you manage your month, your year, getting downtime, family time, work time, patient time? How do you do it? Bala, maybe you go first. You're running an ICU where machines go beep all the time. So,
Well, when it says beep, then it's time for me to leave. No, but look, there is no simple answer. The people have many different ways of managing this, and I think you have to become efficient. And efficiency is very, very critical.
your mic is muted, Bala, somehow.
Sorry, am I muted? Sorry. Can you hear me? Yeah, I think being efficient with your time is very important, and how obviously, and that comes with experience, and there are during certain stages of my career, I did not get sufficient family time, and I have to say that I just didn't get it. I just kept working, and then I'm making up more for it now by spending a lot more time in the kitchen than I ever did before. So it comes, and it comes in different ways, and I think you also have to recognize that if you want to achieve, be a clinician and then have a busy research career at the same time, it can't be done in a 40-hour week. It just can't be done. If you want to lead a big lab, if you're a full-time researcher, it's one thing. But very often you end up spending a lot more of your personal time. At least that's what I've found. To be able to, if I'm doing 4 trials in India and 1 trial here, that's what it takes. It can't be done in a 40-hour week.
So other members of our panel must be efficient time managers as well. So share your secrets.
Again, not the time management. The operating theatre is just the worst time vacuum in history. Like, you walk in there and you actually have no idea when you're going to be walking out again sometimes, especially when you're relying on a different surgical team to actually finish their bit before you can start yours. And like Bala, I've made massive, time management mistakes throughout my entire life. I guess, throughout different periods in your life, you naturally will have to manage your time differently. When you've got stuff due, you just kind of push everything else to the side. There's the burner theory, right? You have like 5 burners and you can't have all of them on at the same time. Some have to be on more than others at certain periods in your life, and others just have to be off. So, thankfully the people around me have kind of gotten used to that, but it's not been easy. And you'll make mistakes if you want to be ambitious, I suppose, but just, think about things very carefully before you work out what you're going to apportion your time to, and it has to change from one period to the other in your life.
Claire or Dietmar, would you like to add any secrets of how you prioritise your time? What you would change, what advice you would give to someone else coming through about things you've wasted time on that you wouldn't bother with now?
Oh, God. I don't know that it's wasting time. I think you use your time. So it's about efficiency, but it's about getting every bit out of what you do. So it's focusing on everything at that time. So it's being in that moment. So if you're with patients, that's it. You're not thinking about about other things. You're with that patient. If you're at home, you should be thinking about your family. That's the way I've worked it. If I'm at work in my research group, I'm working with them. So I try and focus on all of that. And when I'm on my own in the car or in the shower, then I can think about whatever I like and think about ideas. So it's trying to make the most for me about every moment I'm there, and learning from that as you go. But I don't have any secrets about managing time. I'm late for everything. Everybody hates that. My family really hate that. I get into a lot of trouble, and the clinicians also hate it. My nurses, send me texts all the time saying, "Are you coming to clinic? You're late for this. Are you on the ward? Where are you?" etc. So I get, people all know that I'm useless about time management, but most people are forgiving, and they don't mind if you at least concentrate on what you're doing when you're with them. So that helps. So that's my only message.
So I think one thing you hear from everybody, very important, you need to reflect and you need to analyze on your time management, right? So you first have to find out what you do. That's, for me, the first step. And that's not a secret, right? I think there is no secret. So that's really important. And then when you do this reflection, then you have to set priorities, right? And again, when you do this reflection, then, for example, you find out, you can debate if this is wasted time or not, but that you spend 3.5 hours per day on your smartphone looking at Facebook and this, and this, right? But if you don't do the analysis, you are not really aware that you do that, right? And then when you know that, and then you know that you are missing 2 hours of studies, and that is reflected in your marks, that is reflected in other things, then you have a good way to change this, right? So again, especially as a student, I think reflection, analysis, and then structuring your day, and then put in also times where, you just chill and so on. But especially, and I think I've heard this so much, right? But in today's world, the distractions you get is just so much more at the time we were students. So I think, therefore, to do that is really important, and not just let it go. And there's a lot of courses you can take, in doing this organization and so on. So I think that's, especially for a student and young doctor, is really important. And then as you mature in your career, I think one of the most important things is delegation, which frees your life, that you give the responsibility to others and that you let go.
Thank you, panel. Now, having spoken about time management and efficiency, I realise I am slightly over time. So that's a segue for me to thank our panel. So I'd like to thank Professor Bala, Venkatesh, Wainwright, and Michael Wagels. Thank you to our online audience. Thank you to Isaac for chairing this later session between morning tea and lunch. For those of you online, we'll be breaking now until I think it's 1:20, and then we'll regather at 1:20. So I invite you all to thank our panel, and I'm sure that if you have any burning questions, and I know there are some questions from online as well, our panel would be only too happy to answer them either by email or face-to-face over lunch. So please join with me in thanking our panel. Thank you.